and the hypothalamic hypophyseal tract. One's a tract and one's a portal system. And they both are involved in what this is. This is the pituitary gland. So we've seen this before. And if you looked closely at the sheep brain, the pituitary was swung back, if you remember, and it was much larger relative to the brain size. But it had a dark side and a light side. And the posterior pituitary is much lighter. It looks like nervous tissue. And if you remember, nervous tissue, usually, especially because most nervous tissue in our body is myelinated, you'll have this like white, not non-staining, but it doesn't stain as well, so it's usually lighter. So the posterior pituitary is always going to be easy because as long as you know you're looking at the pituitary gland, it's very easy to pick out the posterior pituitary. It's just going to be the lighter region. And then the anterior pituitary isn't light at all. It actually usually stains really well, so it's usually pink or purple, and has the appearance of more like epithelial tissue, actually. And the reason that one looks like nervous tissue, the posterior pituitary, and one looks like epithelial tissue is that one of them evolved from your brain, and the other one evolved from the back of your mouth. And so that is actually epithelial tissue. And so the anterior pituitary actually used to be an endocrine organ in the back of your pharynx. And then it basically migrated up slowly over many, many years. I don't know that anyone knows how long it took. Because anatomy is not in your genes in this way. It's much harder to know anatomical things from your genes. You can't just sequence genomes that way. You have to you have to look at the skull of different organisms to figure it out. Posterior pituitary evolved as an extension of your brain, basically. And the reason I even introduced that is it may help you remember which part of the pituitary gland is attached via tracts. So if one of them evolved from the brain, nervous tissue, and one of them evolved from the back of the mouth, which one do you think uses tracts to communicate? Should be the posterior pituitary. That's exactly right. And so this is our hypophyseal tract system. It's just like everywhere else in the brain where you have tracts connecting one area to another. And so oxytocin doesn't just get to leave whenever it wants. It gets a stimulus up near your hypothalamus that is going to cause the release of oxytocin and antidiuretic hormone. Now, the anterior pituitary does not have tracts that go directly to it. It has tracts that may act on, this is the hypothalamus up here, and there's a capillary bed up in the hypothalamus that monitors your blood, basically. And so it can actually be acted on. The hypothalamus can be acted on to release hormones into this blood vessel pathway that are then released from the anterior pituitary. And so you have a blood-centric region rather than a tract-centric region, and this is called a portal system. So this is the hypophyseal portal system, or hypothalamic hypophyseal portal system if you want to give it the full name, because it is a blood connection from the hypothalamus to the anterior pituitary. Now I want to explain what a portal system is because this will pay off down the road. This is the first portal system we've talked about. I feel like maybe I brought it up before, but I believe this is the first portal system. So a portal system doesn't seem that cool until you realize how rare it is in our body. What a portal system is, so normally, first we got to say normally how blood flow works. You've got arteries that lead to a single capillary bed, and the capillary bed is the only place where exchange happens. So you basically ride in the artery to a capillary bed, and there's one stop on this expressway. You get off, or you get on in the one capillary bed. Then if you were to get on at the capillary bed and you're stuck. You're going to go all the way back to the heart and then make it all the way back around. It's like a stupid subway system that has like one stop that does a big circle for some reason. That's how our normal circulatory system is. A portal system has two stops. You come out, we'll say, into the neck, into the brain, and then you can get off and on in the hypothalamus, and you can get off and on in the anterior pituitary system, anterior pituitary. And so this is like a portal. You can go from here to here without circulating through the rest of the body. And so again, it's like, oh, well, why don't we do that with everything? Well, not everything is built efficiently. But the advantage of this is that you can release things in the hypothalamus, and it will not go to the rest of the body necessarily. Whereas most other places in the body, if you dump it into the circulatory system, it's going to go systemically, and there's nothing you can do about it. The reason this is good for us to talk about now is when we get to the liver, The liver is one of the parts of the portal system for your digestive system. You have a capillary bed in your stomach and in your small intestine that absorbs the food. And you don't want the food to get dumped into the circulatory system. You want it to get off at the liver. So there is a hepatic portal system as well. In the kidneys, it's harder to explain why we have it, but there's another one in the kidneys too that is another portal system. So that's what a portal system means. It's purely blood-based, whereas a tract is basically just a bundle of axons in the central nervous system. And so we have very different mechanisms for releasing hormones in the anterior and posterior pituitary.